Hello, and welcome to the Looking Place podcast, where we seek to guide our listeners through a journey of discovering your intrinsic power. I'm T.
And I'm Mel. Welcome and thank you so much for being here. We appreciate each and every soul that's here today.
Thank you.
So,
Yes.
T, what are we going to talk about today? One of the
Well,
things I suggested was mental health.
mental health.
Yeah, so I just think it's important. Um, Not that I have any specific insights about it or anything like that. I'm learning about it. Um, I myself suffered with depression for many, many years. I just didn't have a name for it. Didn't know it didn't We didn't really talk about it growing up. Like it wasn't really part of what we communicated and how we communicated in terms of, oh, are you depressed? No. You just kind of really got yourself together. So I just really wanted to talk about it because especially in our communities, we have more and more situations, and I just think the more we shed awareness on it, then people can really get help for what they're trying to manage. I mean, what do you think?
Yeah, absolutely. I feel like mental health disorders are something that we've not, maybe in society and maybe specifically within the Black community, have given a lot of validation toward. And I think it's
Mm-hmm.
been maybe within the last, I don't know, less than 10 years that we're starting to become very vocal about
Mm-hmm.
addressing mental health issues. I love the fact that there are some personality celebrities out there, not that I'm giving anybody any particular shout outs, but just Charlemagne the God comes to mind because he's been
Mm.
so vocal and transparent in that space of addressing mental
Oh,
health
wow.
issues. And
Okay.
yeah, and just mental wellness in general, and not just him, but that was the name that came to my head. So I think
Mm-hmm.
it's definitely a topic that we've shunned from for maybe just lack of insight and lack of perspective and lack of being able to really be in the space to think about our mental wellness. I mean, we've been in survival mode by and large for so long that we just haven't had the capacity to address mental wellness. Not that that's not the
Mm-hmm.
priority right now. So to your point, a lot of it's been, get yourself together, and it's just kind of been very dismissive of what may actually be an obstacle and a barrier to living a full and happy life.
Yeah.
That being said, I don't know a lot specifically in the space of mental disorders, but I do know by and large, we are a people who, I don't know that I could find anyone of any social status, economic status, educational status that hasn't suffered at one point or another with some level of depression or anxiety. And
Mm-hmm.
so I
Yeah.
definitely feel it's worthwhile to discuss it.
Yes. And I just want to make sure the audience knows that when we talk about it, we're not talking about like, oh, I just had about a depression because I lost my job. No, we're talking about something that's consistent. It doesn't go away. You know that you may feel that there is a problem because everybody experiences some sort of depression and anxiety like you were talking about, T. However, for some people it goes deeper. Um and it's interesting because we're taught to manage our physical health. Exercise at least 3 times a week, eat right, drink water, your spiritual health. We're taught to manage that. Where for some people, it may be go to church, study your Bible, pray, meditate, whatever. But then when it comes financial health, we talk about the financial literacy, like you want to improve that, increase your business acumen, that sort of thing. And when it comes to the mental health, now, like you said, maybe a decade or so ago, we're starting to talk about it. But it's not with that same that we talk about physical health or spiritual health. It's just not with the same. And it's kind of like we're tiptoeing around it. And some people are, like you said, are coming out. I didn't know that about Charlemagne. I mean, I've heard him on YouTube, but I don't really know. what he stands for, what he talks about. But so that's just good to know. And like you said earlier, there are some celebrities. I think about Taraji P. Henson. I think she was
Mhm.
going
Yes,
around to
exactly.
certain HBCUs talking
Yeah,
about
yeah,
mental
yeah,
health. Yes.
yeah. He's a great
So,
example of that. Yeah.
yes. So I just think I want people to know too, it just doesn't start like you don't have to be icon to do this. We
Not at
want the
all.
common people to take a look. Like you got to go inward and really ask yourself, is there something there? And sometimes you may not even know.
Right.
I'll give an example. What happened to me? I got married in '89, so it was in 1989, and I got married, and I just have to say this that I have those empathic tendencies, so I can feel a lot. I do have the physical one where I can feel people's pain, all this stuff. Okay. So I get married, and all of a sudden, I'm having pain all over my body. It was like a
Mhm.
nightmare. Getting in the car, I had to have 2 or 3 pillows. I'm taking some Advil or just pain. I went to the doctor, and do you know what he told me? And I'll
Right.
never forget. He says, "You have a case of maldepression." And I said, "No, I don't."
Mm-mm,
He
that ain't
said,
it.
"Yes, you do." I said, "No, I don't." And so I left that office that day. I went home and I said, "Honey," he said, "I had maldepression." I disagree with that. I don't have any depression.
Right.
I didn't even think anything of it. 2 weeks later, guess what? I realized
But
all my pain is gone. What happened? I hadn't even thought about it. And the only
okay.
thing I could think about is he brought awareness to it. Brought
Wow. Okay.
awareness to it. And then
Yeah.
it dissipated. It
Wow.
dissipated. And so
Mm.
off and on, I mean, I just thought that that was just kind of normal.
Right.
I just thought it was normal. I didn't
Right.
see anything wrong with it because I
Right.
was that way. As I could remember as far back as being a teenager that I would go in my room, I would read books. That was my escape from the world. That's what I did. I didn't really get that maybe I was depressed. But when I thought about it as an adult, I thought, I think I must have been depressed. But I
Right.
had
Yeah.
no words for it. That was
Work.
just
That's the
normal for
part.
me. Yeah, it was just
Yeah.
normal. So it's kind of like when I was 24, I was reading some information about children who grow up with an alcoholic parent. And my father was a
Hmm.
functional alcoholic. So I'm 24, I
Okay.
call my sister and I say, "Do you think daddy was an alcoholic?" And she says, "Yes, ma'am." I
Duh.
It didn't register. It just didn't register.
Wow.
Like
Yeah.
it just started to hit me. So that's kind
Hmm.
of how this whole depression thing was. And I will
Okay.
say that I ended up seeing a psychologist.
Okay.
This was maybe 6 years later. And I remember calling my mom because he said, let's get a little bit more history. So I called my mom and I told my mom, I'm seeing a counselor, a psychologist who's a psychologist, and he wanted me to get more history. And this is what I said to her: I want you to know that I'm not crazy. And she said, "Oh, no, I don't think that. It's good to get some help." But that was my first thought. I don't want
You
you to
needed to
think
give
I'm
that
crazy.
disclaimer. Yeah. Mm.
So that could
Wow.
be
Yeah.
how a lot of people feel. Like,
Mm.
why would I
Yeah.
go? Then people are going to think I'm crazy.
Right.
No,
Yeah.
you're not crazy. You're
Yeah.
not crazy. It's just that we have to manage our mental
Yeah.
health like we
Yeah.
do our physical health. You go to the
Yeah.
doctor for your physical health. You don't say, "Oh, I don't want you to think here." No, you just go. You just go. So I
Mhm.
just feel like it's so important. I saw a counselor. He wasn't the first one. I've seen other ones, and each one has helped me on my milestone. And sometimes it's that we don't know what we're dealing with. Like I had no idea
Mhm.
about generational trauma. No idea
Right.
back then. didn't know that the thing existed. That I
Right.
do know in the Bible, T, it talked about how we can have generational curses passed down
Mm-hmm.
3 generations. And so growing up a
Mm-hmm.
Christian, I learned that later in life, like,
Mm-hmm.
oh, what is
Mm-hmm.
this talking about? As I started
Mm-hmm.
to do research, like scientifically, it started to say the same thing. They were on the same page. One called it curses, one called it trauma. And
Okay.
so I'm like, wow. So a lot of this could be no fault of your own. Like
Right.
if something is passed down to you generationally through your DNA, you're going
Mm-hmm.
to get it. You're going
Right.
to get it. And it might not be any fault of your own. And then you go through
Right.
your own stresses and traumas every day.
Right. Right.
Um, so that kind of stuff I learned later in life.
Okay.
However, I think is important. Like all this empathic stuff that I learned about myself. Like I just didn't know I would feel every day of my life. I've grown up with some type of an ailment. No kidding.
Okay.
My stomach
Wow.
hurts.
Okay.
Oh, my allergies.
Mm-hmm.
Oh, my back hurts.
Mm-hmm.
It was something that even throughout adulthood, every day. So
Yeah.
now that I know about empathic people, you could be very sensitive to other people's energies
Yeah.
and
Yeah.
you absorb these energies.
Yeah.
I had no
Yes.
idea. And once I
Yeah.
learned about it, awareness, again, awareness,
Mm-hmm. Mm-hmm.
then I started to see, OMG, this is why a lot of times I will say, I just need to go be by myself. Let me go to my
Yes.
room.
Yes.
That's my way of rekindling, renewing, all of that.
Mm-hmm.
Because
Mm-hmm.
I didn't realize I was absorbing other people's energy. Once I started
Right.
researching it, I'm thinking, OMG, this is
Yeah.
what's been happening all these years.
Right.
And it appeared that it was all me, but some of it was just other people's energy that I
Right.
absorb when I come near them. So again,
Right.
learning all this stuff, it's been something to learn all this stuff. It's good because I love learning. However,
Right.
it can take work. However, if you seek help, that therapist may already know a lot of this stuff.
Right.
They didn't
Right.
know this stuff back then. And
Yeah.
so you can really knock some years off by just getting some help. That's
Right.
really what I wanted to say there. So
Right. No, I agree with that. And I think that that's a major point to make is that at the point that we're in society now, where we are just at least more accepting of the discussion of mental health issues, get help. Because at the end of the day, when we talk about financial wellness or physical wellness, these are very tangible things that the mind can very, I'm not going to say easily, but the mind has something to be able to gnaw on. So if I give you, if I tell you a set of exercises to do for the wellness of your body, that's something very tangible, doable,
yes.
actionable.
Mm-hmm.
If I give you a budget to set for your financial wellness, that's very actionable, doable, tangible thing for the mind to wrap around. But then when you think about the mind trying to conceive of itself, right? How do you show somebody that? How do you show someone to go within to observe what the mind is doing? Have observe the mind. Like that's all concept. There's nothing tangible about that. And
Mm-hmm.
so when you talk about getting help, I think that that's such a powerful place that we're in society now where it's like most people who are well-intentioned people are saying yes, get help, and everybody could benefit from talking to someone. You don't necessarily have to be in a state of manic depression or a
Right.
state of
Yes.
to qualify and to be worthy of getting help from someone who may be able to help navigate that part of your journey.
Right.
And so, when you say things like, it was the awareness, that is ultimately what we're always going to come back to when you go down that journey of looking at the mind, looking at what the mind is doing as it impacts your reality.
Mm-hmm.
It is always going to come back to that awareness because that essentially is the power. That is our power. That is our
Mm-hmm.
God essence, if you will.
Mm-hmm.
And, I myself have can, um, I've had some, moments of being in depression in my past, in my past, in back in the day. And to your point, I didn't have the language for it. And so I didn't
Mhm.
identify being depressed then. It wasn't until later, retrospect that, oh, okay, I was depressed. But, I mean, I was severely depressed at one point
Mhm.
and did not have the language for it and did not even consider that that was what I was dealing with. I was
Right.
kind of externalizing everything because that's all I knew how to do. And
Mhm.
there was never any discussion about mental health and wellness. If anything, it was just like, yeah, like you said, go to church, get your mind right, pray, and not to
Yeah.
discredit those things, but
Mhm.
that wasn't, that wasn't the conversation that was going to help me navigate that journey.
Right.
And it's just by the grace of God that I did navigate that journey. But, at the end of the day, when we're talking about the language part of it,
Yes.
the validation part of it, I think that that's helpful for a lot of people now to be able to say, okay, despite what people see my life as, yet and still I'm going through this issue that is unique unto me
Right.
because
Mhm.
nobody has this mind that I have. I love the example that was illustrated. If you put a group of people in the same event, we're all at the same event. We're all watching the same movie or something to that effect. We can all be doing the exact same thing at the exact same moment and have a completely different experience based on our perspective. And so
Yes.
when we talk about the mental health, mental wellness, mental disease, disorder, that is a world so unique that it's almost impossible to have a person share your perspective. And that can feel
Mhm.
very lonely. That can feel very isolating. And so when we say now, everybody get out there and get some help. It's not diminishing. It doesn't make you weak. It doesn't make you
That's right.
incapable yeah, get out there and talk to somebody that might have some tools or a skill set that's going to help you navigate this part of your journey. And I think that that is the
Yes.
overall message that we would want, because I'm no expert on mental health at all, not even close to
Mhm.
it. But one thing I
Mhm.
can say is if we allow ourselves the awareness, number one, I'm going
Mhm.
through some things mentally that are impacting my life and my existence, and then give
Mhm.
ourselves the ability to get that help without self condemnation, without the disclaimer, I'm not crazy. I just want, you don't
Right.
need you don't need all that. Yeah.
Right. Yeah. Yeah. No, I totally agree. And I think something you said, like looking at it from a positive frame of mind versus a negative. For the life of me, I I don't get, but and I do get how we look at physical health so differently from mental health. Something else that I learned about just with the mental health, like trauma is stored in the body. And it doesn't have to be that you were physically abused, sexually abused. You might have been emotionally or verbally abused. Trauma is trauma. And trauma is not the event per se, like, oh, that was a trauma. It's how it's processed in the body. That's what
Good point.
trauma is. And so when there's a book called The Body Keeps the Score, and then there's another book called My Grandmother's Hands by Resma Menachem. And I think about those books. I mean, it's different people. I've read different books about trauma being stored in the body. So when
Mhm.
trauma is stored in the body, it can affect different organs. It could, because it affects your cells. It affects all of you, your muscles, all of
Mhm.
this. And we don't even know that. So moving around helps.
Yes.
However, if you don't even know that, you don't even know to move around. When you're depressed, what do you
Right.
typically do, T? You
Just
just
want to
want to
lay
be,
around.
yes,
Mhm.
that's it.
Yeah.
Who wants to
Yeah.
go to the gym? No,
Mhm.
like you just want to lay around. And I remember when I was going through severe depression, I could work and I was a
Yeah.
whole different person at work. I'd come
Mhm.
home and I was depressed. And all I wanted to
Mhm.
do was go to my room
Mhm.
and get in my bed. In fact, it's funny because I will wake up in the morning and say, I can't wait to get in my bed tonight. Like that was
Yeah.
how I started my day. And
I
now,
could definitely identify and resonate with
oh my
that.
gosh, like I was
Yeah.
like, you wake up and you can't, like, what? That should have been Houston, there's a problem.
Yeah. Yeah.
It didn't even register that there was a
Right.
problem. So
Right.
just if we look at it differently, because once we start learning about the nervous system and
Mm-hmm.
how the nervous system has a certain capacity within our bodies that it can hold. And
Mm-hmm.
once it's over that, you're going to start seeing symptoms. There's a book, another one called it's a generational trauma. It's by Dr. Muriel Bouquet,
Okay.
Buque. That's another great book. And she talks about it as well. Trauma being
Okay.
stored in the body. And she's a psychologist, and she's from the Dominican Republic, and she takes on a
Okay.
whole different level of it in terms
Okay.
of dealing with it from a generational standpoint, and how she helped her patients when nothing else helped. Nothing else.
Mm.
So that's when she thought, must be something else to this. We're doing all of these things. So
Do
there's
you
so
know of any
many.
of like the techniques or discussions that she was having? If you could maybe just give a little bit of insight as to
Mhm.
methods she may have
So
used.
yeah, so one of the methods that she used was she first of all got you present to being in the present moment. So there are five things you have to look around the room. There are five things that you see. There are four things that you touch, three things that you hear, two things that you smell, and one thing that you can taste. And with you doing that, that really gets you in the present moment, because a lot of what we do, we're just so in the past, or depression, or we're in the future, anxiety. And so she talks about, which a lot of people talk about, not unique to her, just being in the present moment. And then the other thing that she talks about is you have like different, you're going to have different chairs, and one is going to be like your higher self. And then you're
Okay.
going to have your ancestors' higher self. And you're going to ask, she had a list of questions that you can ask. Like you're going to ask your higher self this, you're going to ask your ancestors this, your ancestors' wisdom or higher self that. And
Okay.
you would just go around and you would just sit, like maybe three chairs, and you would sit in those chairs and you'd ask a question, and then you sit and then you wait and to get the answer.
Okay.
But and what it did was it really put you in touch with yourself, like your
Mm-hmm.
higher self. We negate our
Mm-hmm.
higher self. We just think,
Mm-hmm.
man, that doesn't exist. We just have this body. And so she
Mm-hmm.
talked a lot about your ancestors' trauma being passed down
Mm-hmm.
and your ancestors' wisdom.
Mm-hmm.
You get that too. And
Yes.
I grew up in an era where we didn't really talk about T, like the whole ancestral thing. No,
Right.
that was taboo because I grew up Christian, and anything dealing with the dead or anything, it was taboo. Do you get
Yeah.
that? So now
Yes,
I'm reading this.
absolutely.
Yeah, now I'm reading this stuff about, oh, what? Ancestors' wisdom. Like, it's just totally new to me. And so
Right.
I'm on a whole new trajectory of learning, and it's good. It's good because I feel like I'm transforming from learning this stuff. Dr. Muriel talked about how she went to Columbia University, and she was one of the few minorities in her class. And she went to her mom because she was ready to quit because she felt out of place. She felt the racism and all of that. And her
Mm-hmm.
mom told her, you come from a race of people who have great wisdom, fortitude.
Mm-hmm.
You
Mm-hmm.
go in there and you complete your program with the
Yeah.
strength from your ancestors. And she said she really took that in, and she went in there and she completed the program. She really
Mm-hmm.
got how much power her ancestors had, and she took that on. Because a lot of times we just think about the trauma, but no,
Mm-hmm.
there's great wisdom and fortitude with our ancestors as well. So
Mm-hmm.
we have to, like I said, that's a whole different conversation.
Yes.
And we have to really, it takes some exploring, but for some people, they don't want to do all this exploring, and
Right.
you don't
Right.
have to. I love learning, researching. I did all that. And then happened to find a therapist who knew about all of that as well.
Mhm,
And so
mhm,
that really helped me as well. You can find therapists like that. Reach out. I'll be happy to direct you. Or you can look online. One of the things that I feel strongly about is a therapist who's a psychotherapist. P S
mhm.
Y. How do you spell psycho? PSY.
Don't put me on the spot.
PHO. But anyway, if
Big
you look up
booty.
psychotherapist, it might be
Uh-huh,
PSYCO.
uh-huh.
Psychotherapist, they deal a lot with the body. And
Mhm.
so I've been through a lot of different types of therapy, but they deal a lot with the body. And
Okay.
that's one of the things that I feel like could be missing from just traditional therapy. Not that you don't need traditional therapy. However, I just feel like dealing with the body, because when we talked about trauma stored in the body,
Right.
they help a lot with that. They help a
Right.
lot with that because
Right.
I think what I think too as well, T, is sometimes it's not like you're having, like you might think, oh, I'm going through depression. Sometimes you just need to eat better.
Good point.
Like, yeah, you just need to eat better because when
Get
you
some
eat,
sleep, drink some
yeah,
water, yeah,
yes,
or
yes, and I
hydrate, like
know
you
you
said.
have your
Mhm,
certificate in that area of
mhm.
health and wellness as
Right,
well, and I've just
right,
done it for so long, many
right.
decades, and all of that. But I do know that when I eat a certain way, guess what? I don't feel as well.
Absolutely,
And trust
absolutely,
me, I've tried it out. I said, let me see if this
absolutely.
works because that's the kind of person I am. Let me
Yeah,
see if this really works.
yeah,
So I'll
yeah.
eat right and then I won't eat right. And I
Mhm.
said, yes,
You
there's
see
a
the
difference.
difference. Yeah,
And
absolutely.
I
That's a
can be
great
hard
point.
headed. So I tried it more than one time.
That's a great point. That is a
The
great point.
same
Yeah.
answer.
I know for me, I don't, it's not that I don't metabolize alcohol, but alcohol definitely has an effect on my physical state. So I know if I have like a hard alcoholic drink, I
Hmm.
know the consequence to that physically, how I'm going to feel, and even mentally, how I'm going to feel. I'm going to feel sluggish. I'm going to feel foggy. I'm going to feel blah. And so
Hmm.
I'll ask myself, you can have that drink and you can have fun with that now. Just know, you're going to pay a price. And do you want to pay that price? And so when we talk about the
Yes.
awareness of how those things affect our mental state, I think that is an
Hmm.
excellent point. Excellent point.
Yes. 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 Even just fresh fruits and vegetables can
Yeah.
make a big difference.
Yeah. Yeah.
Drinking water. I usually put a little lemon, little lime in
Hmm.
my water.
Hmm. Hmm.
That makes a big difference. It just kind of helps you to
Hmm.
get clear. I'm not saying that it's going to clear your depression. I'm
Right.
just saying
Yes.
it just kind
Correct.
of helps alleviate
Helps. Yeah.
something.
Or you can at
Moving
least
your
see how it
body.
negatively impacts. Yeah.
Yes. Hmm.
Hmm.
Moving your body, going to the gym,
Yeah.
walking, dancing, moving those, I call them energy centers.
Hmm.
That's a whole nother topic for another day.
Hmm.
However, moving so that that
Yeah.
energy that's stored in the body, that's
Yeah.
stagnant energy, can
Yeah.
start to move out of your
Absolutely.
body. Um,
Absolutely.
so some things we do have to do on our own. That will also start you to just thinking, because sometimes you could be so depressed. I've been like this, like I can't even think clearly.
Yeah.
So to tell me to
Absolutely.
see a therapist, my mind
Yeah.
would be,
Yeah.
but
You're
once I
not even
start
there.
doing certain things, yeah, I
Hmm.
can start to think a lot clearer.
Yeah, and I think that's a great point because here's the thing, this is not going to be a one size fits all type of solution. So to
Exactly.
say, yeah, go out there and get help, help can look like a multitude of things. Explore that journey of what your help looks like, or explore that journey of how much outside help you need versus how much you can go within and get what you need. But the point being to that is with, I appreciate that you can, give us some books and some resources. I'm not the most well-read person. Not ashamed to say that. I'm
Mhm.
educated. I like to
Mhm.
consider myself an intellect of some type, but I'm not the most well-read person. And so when it comes to my advice to people, I say tap in and then try to explore what that journey looks like for you. Don't put a limitation on it. It has to look like this, or it has to look like that, or I have to feel it here, or I have to do it this
It's
way.
different
There's
for
no right or
everybody.
wrong. There's no right or
Mhm.
wrong to navigating your journey. And so for
Mhm.
some people, especially when I'm working with with my patients, when I'm doing physical
Mhm.
therapy, a lot of the discussion I have now, especially as I'm really cultivating my connection with God, I feel God leading me in a lot of these discussions that I'm having with my patient outside of the diagnosis that they're there to be treated for. It's not, most of the time, it's not just about that issue. It's, you might come here for your knee pain, but maybe it's not just about your knee. And a lot of
Right.
people now are voluntarily, not me prying, not me trying to, but a lot of people are having conversations with me that they are wanting to have outside of the scope of just their physical dysfunction.
Yeah.
And it's relating
Mhm.
all back. And so what I've kind of been telling people or sharing with people, not because there's no instruction, but kind of what
Mhm.
I've been helping guide people toward, I say, okay, for example, we'll take the knee pain. Okay, your knee hurts. Okay, how
Mhm.
does that make you feel? And so, and I am by no means trying to give them any mental, psychological, or therapy outside of physical therapy. I'm not trying to encroach on any other territory, but we're just
Mhm.
having a conversation person to person. How does that pain
Yeah.
make you feel? And so they'll start to give all of these descriptions. Well, I'm frustrated. Well, I can't do the things I used to do. I want to be able to get out there and garden or dance or pick my grandkids up or whatever the case may be. I'm annoyed. I'm frustrated. I'm depressed. And
Mhm.
it's kind of on that cycle. So the pain brings the dysfunction. The dysfunction brings the emotional response, and it's
Yeah.
kind of going round and around. I said, well, let's do this. If you don't mind, let's just take a very, very subtle shift of perspective. No big leaps and bounds. Pain is there. Okay. Instead of suffering the pain, use it as information. So
Mhm.
almost kind of disengage from your personal emotional response to the pain and observe what your body's communicating to you. Praise God,
Yeah.
your body is communicating to you. And I may not always say praise God, but your body's talking to you. That's a good
Mhm.
thing. Lean
Mhm.
into that awareness and let that be something that gives you a little bit of power to navigate this journey of knee pain, just using that example.
Yeah.
And so when I'm
Yeah.
having these conversations with my clients, it's almost like I kind of, in almost real time, can see something lifting off of them where they're like, okay,
Wow.
the pain can be there, but you don't have to suffer it, and you
Mhm.
can acknowledge that the pain
Mhm.
is there to maybe give you some information to tell you, hey, don't do that, or let's
Yes.
do this.
Mhm.
And so I say all that not to go off on a tangent, but when it comes to that awareness and that just subtle shift of perspective, sometimes it can just be very simply there. Maybe you're not, to your point, maybe you're not ready to full on have a discussion and session with a therapist, or maybe you're not in the space where the words in that book that you may read are going to resonate. But at the very foundation and most basic, I guess, starting point, if you will, is you can just bring that awareness to what it is that you're going through. I
Mhm.
have this physical pain, or I have this emotional pain and trauma.
Mhm.
Maybe I can't be rid of it, but I can be aware of it. And when you
Right.
bring that awareness in, and this is by no means me saying that that's going to fix everybody's problem all at once, especially if you have, and we're not even talking about clinically diagnosed mental health disorders, but just on the kind of social level, when you
Mhm.
bring that awareness in, it almost naturally makes that emotional negative state kind of dissipate naturally. At least
Mhm.
that's been my experience,
Mhm.
because again, going back to a fact, I was severely depressed at one point in my life. I didn't have the language to put to it then, but I was severely depressed.
Mhm.
And understanding now what that felt and looked like for me then, I can still have states of negative thinking, I guess
Mhm.
depressive thoughts if we want to label it, but now I can just kind of be aware of how that is manifesting in my mind, and that
Yeah.
how that is affecting my reality. And
Yes.
I
With
think
that.
that for a lot of people, if depending on where you're at in that part of your journey, allow yourself to just start at maybe just the simplest place. You talked about being present and sitting in
Mhm.
that moment of presence where you're just kind of, you're not fighting the mind, but you're just so present in the moment. You're focused on your breathing, or you're focused
Mhm.
on, a bird chirping, or anything that brings you in this right now
Mhm.
present moment. It almost kind of naturally makes the mental processes dissipate for a moment. And then they're going to come back. And then you come back to your presence, and you come back to your
Mhm.
awareness, and it's kind of that oscillation, that
Yeah.
fasciculation. And I feel like if people can at least start there, at least it's been my experience recently and working with my clients, of just giving them that little bit of shift of perspective, it has been,
Mhm.
to their admission, so impactful in their journeys. I've had so many people come to me recently and tell me just how different their journeys have been in that space of just being aware. And it's, I don't,
Right.
not trying to take any credit. It's just where, the discussions that God has allowed me to have with the people who are ready
Mhm.
to receive that. So I'm
To
not just
receive it.
giving this discussion to everybody, but for people who are ready to receive it. And there have been a lot of people who are in this space of wanting to receive something that they don't quite know what they want to receive. They're looking for
Yeah.
something that they don't quite know what they're looking for. And then
Right.
just
Yeah.
like I said, that little bit of shining a light on that awareness and that perspective and how impactful that mental process has been to their lives, then they're able to take that kind of almost objective witnessing point of view to their own life and mental process and feel more empowered to deal with the things that life is giving them.
Yes, I get that. Thank you.
Yeah,
Yeah. That sounds really, really good. That sounds
yeah,
really good. Yeah,
yeah.
so and I want to say that we are not therapists, doctors, so we're not here to diagnose and treat you. So I just want to
Absolutely
make
not.
sure that that's clear. I missed that
Absolutely
boat.
not.
So
We are just two ladies who know a thing or two about navigating feelings of depression and anxiety, and we're just sharing our experiences. No
yes.
diagnosing, no
Hmm.
prescriptions being given out, no direction even. I tell my
Yes.
clients all the time, especially when I'm working with them in physical therapy,
Hmm.
I am a person who has a skill set, but you are the expert on you.
Hmm.
Ultimately. And I
Hmm.
always try to make sure that I'm keeping the focus of power when I'm dealing with a client. Don't look to me as your source of power or
Right.
not guide. Well, I have
Hmm.
to guide you, but you know what I'm trying to say. Don't you?
Yeah.
You are the
Yeah.
expert on
Yeah.
you. You are the
Yeah.
expert. I
You're
have
the
a skill
expert on you.
set. I have a
Yeah.
knowledge base, but you are the expert on you. I am not the expert on you.
Right. Even
Yeah.
physical bodies. Like I love physicians. I have a physician, my
Yeah.
primary.
Absolutely. Yeah.
However, I feel like we're the experts on our
Yeah.
bodies.
Yes.
And we really have to get that. So
Yeah.
I feel like that's important. Just
Yeah.
that you stated that.
Absolutely. Yeah.
So yeah, yeah. So I appreciate that. So
Yeah.
that's really what I wanted to say about mental health. Like, I really want people, you've got to know because how severe it is for you. Sometimes
Right.
you don't even know. So I don't want to put that on people. But what I want to say is not but, and get some help. Sometimes
Yeah.
you don't know,
Yeah.
like, oh, this is depression. We might be yelling at our kids all the time. That's not good
Yeah.
for the kids, and it's not
Yes.
good for you. That's a
Yes.
cue to me that something is dysregulated in my body. Something
Yeah.
is
Absolutely.
dysregulated. So you have to
Absolutely.
kind of look at the signs. Like I said, I grew up where it wasn't talked about your mental health. So things just seem normal. And then you
Mhm.
take a decade later, and I'm thinking, maybe that wasn't so normal. But my parents, I don't blame my parents because
Yeah.
they didn't have language for it either. And
Right.
when I think
Absolutely.
about if you go all the way back to slavery and Jim Crow in America, you didn't, who was going to say Black people, who was going to say that they had depression? What?
Right.
In slavery, oh, well, we don't need this type of person on the plantation. We're going to sell this. No. So you kept quiet. You kept your kids quiet about all that because you wanted to stay together as a family unit. And so I could see how all of this came about throughout the years. Like I could really see how that could happen and why it would be kept quiet. And then it's just passed down. We don't talk about it because your ancestors didn't. That could be
Yeah.
life or death. What?
Yeah.
What are you
Yeah.
talking about? Get out there in the field. I could see
Right.
how it could be life or death. So
Absolutely.
I don't I don't hold anything against them. They
Yeah.
didn't know they were doing what was passed down and you didn't really talk about it. And now
Absolutely.
we're in this new age and it's become the buzzword, trauma, trauma, trauma. So let's get some help for the
Yeah.
trauma. Let's get some
Yeah.
help.
Yeah.
Your neurological system is dysregulated. Let's get some help.
Yeah.
Sometimes it may require medication, sometimes it may not. I remember when
Tell-
I saw a psychologist, referred me to a psychiatrist. He said, I want you on medication because I just want your hormones balanced. You're chemically imbalanced. I fought it and I said, I really don't need medication. And I really still don't think I did. I took it for a month and I told him, that's all I'm doing. I'm taking it for a month. That's not, look, I'm not recommending that. I'm just telling you my experience. And he said, well, did you take it? I said, I did. I took it for a month because I'm a rule follower. So I was going to at least do what he asked me to do. So I did, but then I didn't feel like I needed it after that.
Yeah.
Some people might need it to help them to get balance. Some people might not. I don't know.
And that goes back to me saying we got to take agency over our own experience in this life because it's a unique experience. So that's a great example that you use. If I'm, going through a session with a client and I'm prescribing them an exercise, I will quite literally say, hey, try this, check in with yourself, and then you give me the feedback. Do you feel good about this exercise? Does this feel good in your body? If not, there's another way we can do this. So I'm never just saying, do this 3 sets of 10 of this, and then no, we're going to try it because I don't know what's going to work for you. I have a whole bag of tools, of tricks, of exercises. I don't know what's going to work for you. So let's try a couple things. You check in with you and you tell me how you feel about that. And then, so that's just a kind of simple example of that, but it's the same in really any aspect of life. Everything ain't for everybody. And so when it comes to getting help, that can look like a myriad of things. And so, I would tell someone who maybe even, someone I think is ready to receive this word. If you don't know where to start, and you acknowledge that you need some help and some guidance and you don't quite know where to start, check in with yourself. You are the expert of you. There's nobody with a degree or a financial status or a level of that is going to supersede the expert of you being over you. And so when we talk about, this podcast kind of helping people to navigate their journeys of discovering their intrinsic power, that intrinsic power is coming into the alignment of the true nature of who you are. And everything that you're going through is that process of that. So don't discredit that. But in understanding that conceptually, you have to also understand this mind, this mental thinking mind is oftentimes working against you. It's not working in your favor as intended. And so just be aware of that. Don't even try to change your thought. Don't try to not be depressed. Don't try to put on a happy face and think positive. No effort in that. Just simply be aware of what the mind is doing, almost just observing it. And there is it's just going to come by the grace of God that mental barrier, obstacle, it's going to dissipate. It will. Just try it. And then you will be able to be in that space where you can get intuition toward your next line of action. When you kind of clear out that space, you will get that intuition toward, you could be sitting minding your own business, not even thinking about it. Oh, go look up this person. Oh, that person has, maybe a resource to me, or, whatever the case may be. I don't want to go off on examples, but when you just bring awareness to your mental state, it has a way of kind of clearing that space naturally. And then you can get inspired action. And you can get inspired, and so that's kind of how I feel about the very simple approach to that. And that can kind of, lead to all of the other things that may be helpful to you along that journey.
Yeah. So, well, wonderful, wonderful. Well, T, this has been great. This has been great talking about it. Yeah, I really appreciate everything that you have to share. We want to let you know if you have any questions, thoughts, comments, buts, please reach out to us here.
Yes.
And you can reach out to us on our social media, and that would be great. We'd love to have dialogue. Let us know what you're thinking, even if you want more of this type of a conversation or something else dealing with all of that. Let's do it. So
Yeah,
All
as
right.
always, we are looking for community, and so for those of you who want to be a part of this community and want to share and just help one another along our very unique, beautiful journeys, we're so excited to connect with you all. So thank you for your time and attention in this episode. And Mel, I thank you
Yes.
for the safe space to just talk about these things. And I feel always, even when we're not physically together, I feel your love and your positive energy, and I'm so grateful to be connected to you.
Oh, thank you. I feel the same way. Thank you so much.
Thank you.
So, all
Thank you.
right.
Peace and blessings, everyone. Take care.
Yes. Yes. Peace and blessings.